This is an anterior cervical treatment for the SCM and for the anterior scalenes. You do want to be careful when you set this up because you are going to have your fingers gently around the trachea, which can be uncomfortable for people. So just explain what you're going to do in a very gentle tone. What we're going to do is just place one hand on the forehead and then our thumb on one side of the trachea, fingers on the other. We're just going to gently push the trachea back and forth, stretching it on either end. Should move freely. You will feel some grinding in there. That's perfectly normal. That's just the cartilage. And then you hold the trachea on the opposite side that you're standing, and then you take your finger, preferably your index finger, the pad of your index finger, and I'm just going to effleurage from superior to inferior. So I'm going just on the anterior part of the scalene, deep down into the scalene as far as it will let you go, and then all the way down to the clavicle. Then you take your index finger and your thumb, you pick up the SCM, compress it, let go of the trachea. Now I'm just holding the SCM. Gentle pressure, even from your thumb and your index finger. And you'll want to look closely here because what's going to happen here due to the compression is that this muscle is going to have a twitch reflex. So it's kind of like you're squeezing a grape out of its skin. So I'm going to gently compress until that muscle twitches like that. And then you separate your fingers and let go. And as you can see from that picture, that this SCM is a lot more relaxed on this side than on the side that we haven't treated yet. So just be careful using this technique. Practice it on your friends and family first. One thing that I didn't mention that I should is always ask them to swallow first. That clears their throat before you start the treatment.